Let me start over. Scratch that crap. Welcome to Health and Hormones. It's good to have you back after our summer break. And I'm here today with Laurie Ryan, my partner in crime, huh?
Yes.
Welcome.
Thank you. Thanks for having me.
We have decided that today we're going to talk about something that is a common thing.
Inevitable.
It's inevitable. And unfortunately, it's happening a lot younger in women these days. And we're going to talk about menopause. So I brought in Laurie to help me out to discuss this. So,
All right.
You ready?
I'm ready.
Excited? All right. So any first initial thoughts you want to say, or?
I feel like it is a hot topic, and I feel like it's becoming more discussed, I would say, like
Sure.
more mainstream discussions, which makes me happy because, it is inevitable. It's something that women go through. I always, when I would think of menopause, I remember my grandmother told me that back in her day, when women went through menopause, they would just put them in insane asylums because, because that's the right way to treat it. Yeah. So I think we've come a long way from insane asylums.
So it's interesting you say that. I just talked to a lady, a new patient yesterday, and she told me that she's like, what's going on? Like, she's young, in her early 40s, and going through all these symptoms,
Yep.
hot flashes, night sweats, can't sleep, angry at everybody and the world, and many other symptoms that we discussed. But she goes, so I called my mom, and she wouldn't talk about it.
Yeah.
Talked to my aunt, and it was like, it wasn't discussed.
It was a taboo.
It was a taboo thing. And so we're going to break that. We want to open it up, and we want to talk about everything, because once you learn this, it's easy, and it's not near as complex as everybody's making it out to be.
Yep. True.
All right. So teach us some stuff about menopause. What is menopause?
So, essentially it's a cessation of your hormone production.
Okay.
And so your body goes through this process and it just stops making, all of our essential hormones.
Totally. So by definition, well, first of all, what blows my mind, I think more than anything, is menopause isn't even a medical diagnosis yet. It's not recognized.
It's not.
No, it's just a symptom.
Okay.
So menopause is a symptom. So all of you out there having symptoms, that's normal. That's not even a disease or whatever. But by true definition, menopause is not having a period for 12 months. Mm-hmm. But as we've learned, that's not the easy way to figure it out.
No.
There's much easier blood tests that you can do, and one of them is to check your blood work, and if your FSH is higher than 50, then we know you're definitely in menopause.
And you probably don't feel very good.
And you do not feel good. Yeah. All right. So let's see. The other thing that I think people ask about that's really common is perimenopause.
Yes.
Or postmenopause. Let's kind of break all three of those down.
So perimenopause, I think that is definitely a hot topic, right?
Okay.
You go on TikTok, you go on Instagram, and it's going to be in your feed, right?
Sure.
And I think, again, that's something else that we are talking about more because women are suffering with it. And all of a sudden, this generation's like, hold on, I don't want to feel like this.
And people are talking about it.
Then people are talking about it, right?
They're
Which
looking
I'm
for
grateful.
information.
Yes,
Yeah, it's great.
grateful. So perimenopause is our period before menopause, right? And perimenopause, in my experience, can last a really long time, right? Like women will ask me all the time, like, how long does this last? I'm like, I've seen it, women that have suffered with it for 10 years, 5 years. Everybody's a little bit different.
And as our mentor always said, only God knows how long perimenopause lasts.
Yeah.
Nobody else can answer that question.
Yeah. He might even wonder sometimes.
Yeah, that's right.
And in perimenopause, I don't know. I feel like in our clinical experience dealing with patients, sometimes I think it might be worse for some women, right?
Sure.
And especially if we can treat menopause, right? Perimenopause, I always tell them it's a roller coaster. Your hormones are all over the place because they don't know what they're supposed to do anymore. So you can have a whole range of symptoms with perimenopause.
And like you said, like a roller coaster, there are sometimes that it's good. And so women will say, "Oh, I'm not in it because I'm feeling good right now," and then they have the downward or the twist or the loop, and that's common. What we found an easy way maybe for you guys to understand. So menopause, like Laurie already said, is you don't make any more hormones. So there's zero. You don't make estrogen, progesterone, testosterone, DHEA. Everything is gone down. Like you don't make any. Where perimenopause is what I like to tell patients is now you don't make one or maybe two. Maybe you're not making your progesterone or your testosterone, but you're making some of the other ones. So because you still make some, it's that roller coaster ride. You have some hormones in you.
But you're way out of balance.
But you're out of balance because these hormones balance out by the other hormones. And so it's this up and down. And so by replacing the deficiency in perimenopause, what happens? It's like you feel great.
You feel great. Yep. Yeah. And like we talked about, it's all about balance.
Yeah.
Which a lot of people don't understand. Right. So.
And even more than that, it's optimal balance, right?
Yeah, absolutely.
Trying to get levels, because I know for my sweetheart, her progesterone was less than 0.2, and she was feeling off, so she had none. And as we raised that level, like it's literally changed everything.
Life changing.
Her sleep, her mood, how she interacts with her kids. It doesn't.
She probably tolerates you a lot more too, right?
Somehow she likes me. I don't know. I don't know how that works, but I love progesterone for me. Any other thoughts that you want to share or that you've seen?
With perimenopause, would you say? I think a lot of times, women will ask, am I in perimenopause? And some of the things that we notice is changes in periods, right? Where they can get a whole lot heavier, or we can see a lot more breaks in between periods. Headaches, hormonal headaches are a big one because our body has stopped making progesterone, right? So we see this increase in headaches, sleep disturbances, waking up, anxiety, depression can be a big part of that as well. Or like, I used to like my husband or my partner or, and now it's like, can you just go on a boys trip because I can't stand being around you? Those are things, and you may feel some or all, but those are things that I would say are the most common that we notice with the perimenopause, for sure. So
I just had a patient say, I'd rather have shards of glass in my eye than to be with my husband.
Yeah, and that's horrible.
And she goes, I feel terrible because I used to love it, but that's what happens when that hormone, or because we've talked about it in the past, a hormone is just a key that turns on function. When you don't make it, then those cells are just asleep. They're not on at all, and it makes it worse.
Yeah. Well, and I think the biggest thing too is that, like I talked about, with my grandma, like they just go to the insane asylum, or women don't want to talk about it, right, from past generations because we just accept it, right? This is just something you go through, and you'll get over it. I don't know how many patients we've had come in that said, well, my doctor told me I'll get over it, or they have a hysterectomy, right? You might have some symptoms in the beginning, but they'll go away and you'll be fine. But there's much bigger things that happen, right? The bone health, our cardiovascular health. I was sharing with you that for NP school, I had to take a test, and they talked about that the number one cause of hypertension for women is menopause. How do we treat it? We just put them on a blood pressure medication, right? We don't ever talk about treating
the symptom of a symptom.
Right. We don't ever treat the cause. Menopause. Right. So, and I think if men went through this, there would be a cure.
Oh, well, there is. But you're right, because guys aren't tough enough to handle menopause.
Nope.
And the problem is guys go into what's called andropause, and watch what happens. They go buy a new house, they go buy a new race car, they go off the deep end or go through that midlife crisis, and it has nothing to do with the midlife crisis. It's all that they don't make their hormones either.
Right.
And so, but you're totally right. It would be fixed, but we fix all the time. We fix menopause.
We do. You're right.
And so the terminology of something called post-menopause, I don't even know what that means. I mean, I can define it by Latin.
You're never out of menopause, so how do you?
Because menopause means you don't make a period anymore, or you don't have the hormones to make a cycle and a period and all that. So post means now you're back to having your period? Is that what that means?
But
So when you're 80,
that doesn't happen.
So I don't know what pose means, because once you go into menopause, this condition continues, and the sad part is, like you just mentioned, your bones. We now know menopause is directly linked to osteoporosis. Menopause is directly linked to heart disease, hypertension, directly linked to memory loss and dementia. And so a lot of the diseases that we do treat are secondary, because women have none of these issues while they're having periods. And now we're seeing that women in their 40s that go into menopause, or sometimes in their 30s, they're having all of those diseases now in much younger age, because they don't have the hormones for the protection.
Right. Yep.
So
no, I agree. Or we have a lot of patients that will say, my doctor told me that I could do estradiol therapy, but I have to stop. I can only do it for this many years. Well, because my symptoms will be gone. And it's like, okay, well, the hot flashes, those things, you might get through those, but your bone health and all the other things that you talked about, those don't get better, those get worse.
And I love that you said that, because it's true. Unfortunately, the medical community is treating your symptoms of the hot flashes, and they don't focus on the long-term outcomes. Right? And so we don't treat symptoms. We want to prevent disease and slow the aging process as much as we can, because that's what your hormones do. They can slow that process.
Right. Yeah. And who doesn't want that?
Yeah, totally. Well, tell us, how are you doing? Can I pick on you and
Of
embarrass
course.
you?
I knew I signed up for that, apparently.
All right, good. So where are you at in your life with your
my hormones?
hormones?
Yeah. So about a year, 44, I started having headaches. I was great, felt better than I ever had in my whole life, still felt great, but I did notice headaches every day for about 3 to 4 weeks. I was waking up at night, a little bit of night sweats. And so I had my blood drawn, looked at it, didn't believe what I saw. So I made you look at it. And you said, Laura, you're in menopause. And I said, no, I'm not. And you said, okay, you're not. Just suffer, right? Yeah. So I started estradiol therapy. And within 48 hours, I feel like my symptoms were gone. It was right away. Yeah. So I was sleeping, and
headaches.
Yeah.
Gone.
Headaches gone.
So you're not saying you have to live like that the rest of your life?
No. Even when I tell people that I'm in menopause, they're like, "You're not. I don't believe it. You don't look like you're in menopause, right? You don't seem all these things." But that's the beauty of it.
And just so you know, because looking on the outside tells you everything you need to know on the inside.
Right. Yeah. And I was young. 44 is pretty young, right? But I'm like, hey, you know what? We can treat this. Sure. And I can live my life, and I can, feel good about it. So, and it is important for me to treat it, because Alzheimer's runs in my family. And so knowing those things, better, you do better, right?
Well, I love that you brought that up. One of my favorite, there's a big study called the Nurses Health Initiative, and it measured nurses over a long period of time. One of our best studies in our country, because it was a 30-year study, found the higher the estrogen, the lower the cases of Alzheimer's.
Yep.
So why wouldn't you want all the help and protection you can get for your brain and everything else?
Yep. And your bones and your muscles and all the things, right?
Absolutely.
Yeah.
Well, so, I've treated, I don't know how many patients now. We're very, very blessed. And we have people from all over now coming in just to get help. But it is so disheartening that people are being told, you're not in menopause. There's no way. Yeah. Your labs are normal. And it just, I just had a patient who said in the last 6 months she's seen over 19 OBGYNs, and everyone's told her she's normal, and she's ready. In fact, she wouldn't even talk to me. She had her family member talk to me at first, because she's like, this guy's not going to help me out. And by the end, they kicked her family member off the phone. It's like, I got this. I feel so good because I found out some answers. And so we just want you to know that even if your doctor says that you're normal, doesn't necessarily mean that you are. And so there's a very big component is knowing how to interpret the labs.
Yeah, absolutely.
And how to understand if you're optimized in your hormones. And the problem is perimenopause. A lot of doctors just throw their hands up and they don't do anything. And yet we've learned that just because you're not in full menopause, which means you don't make any hormone, now just because you don't make one or two, we'll replace those. And then your perimenopausal years are phenomenal.
Yeah. Can I ask you a question?
Yeah, of course.
So when you were in medical school,
Okay.
what did
That's a long time ago.
What did you learn about menopause and perimenopause?
Avoid it.
Yeah.
Send it to somebody else.
Right.
No, I mean, the truth is, I was taught that hormones cause cancer.
Right.
Every professor, like, don't deal with that. Like, you'll kill your patient.
Right.
And avoid it at all costs. And I am so glad that I was miserable and going into my male andropause because I didn't make my testosterone and I didn't make thyroid. And so because I was like wanting to feel better, but what's crazy is my wife has gone into menopause and she had one hot flash.
Yeah.
She told me about it. We got blood work, I think that
Probably
day
that
or the next day.
Yeah.
And found that her estrogen had completely gone from being high down. So one hot flash. She knew she had the symptoms. I mean, we've talked about it. You know, I've taught her for years. I've said, babe, if you ever have a hot flash night sweat, you got to let me know right away. She did. Got her on treatment the next day, and now
never had another.
She never had. So she had one. Now feels great. Her symptoms are awesome, and that's what we want you to know is that you don't have to be miserable, sweating.
Yeah.
Unless you live in Arizona, and everybody sweats right now because it's just miserable. So.
Yeah, absolutely.
Anyway.
And that's why I think it's important to go to someone who can optimize your hormones, right? That
totally.
understands it.
Yeah.
So.
I haven't had a chance to talk to you about this, but I had this cool story that happened or experience. This lady has been in menopause, she thinks at least 10 years.
Okay.
New patient this week. And I said, well, why now? Like, why would you come now?
Right, yeah.
And she goes, I have watched what you've done for 3 of my friends. Their whole life has completely changed. And I'm like, what do you mean? Like, they all get up and go hiking. They're exercising every day. They're not gaining, the 40 to 60 pounds that happens in menopause. And she's like, I don't have symptoms like the doctor, because her doctor told me I don't have symptoms, so you don't need to treat anymore. And she goes, but what I feel like is I'm missing out on my life. And I thought, that's the coolest thing that people are starting to wake up to is you don't have to miss out on your life.
Yep. You can live your best life.
You can live your very best life and be active and feel good and healthy and strong. So it was just another reminder of why we need to get this message out.
Yep.
But we have a lot to talk about.
We do,
so
yes.
I don't know if we have time. So we're going to invite Laurie back again if you're okay with that.
Yeah.
And we'll get another episode because there's just so much to talk about. What are your thoughts?
No, I think that's a great idea. And I think if, anyone who's watching, if you send questions or things that you want to learn more about with menopause, right? We can tell you all the things that we know, but it is very, as we've learned with all these stories, it's very personalized. So, maybe things you're suffering with or things you want to know. So we can, jump into those too.
And don't let the internet tell you don't have it because you don't have all the symptoms.
Right. Yeah.
Every person's different. What you feel is different. And I feel like every patient needs to be heard, right?
Absolutely.
But like you said, I had a headache my wife didn't have. So if I would have just waited for a headache,
it's
then
very
I would.
Personalized.
It's very personal. And my wife had a hot flash. So, but you didn't have that. So again, if you're having any of these symptoms, and we'll post a bunch of that for you guys, because we want you to know everything. But send us your questions. Yeah. Again, this is Laurie with Dr. Allen here at Health and Hormones. But we are here to help you feel young again.